Femoral hernia. What is a femoral hernia? A femoral hernia is a disease in which part or the entire abdominal organ protrudes outward through the femoral canal. The surgeon is engaged in the diagnosis and treatment of such a pathology. About femoral hernia. Femoral hernia is a pathological condition that occurs predominantly in women, 62 to 69% of all cases. This is due to the anatomical features of the structure of the pelvis and the muscular-aponeurotic apparatus in the female body. Women over the age of 45 to 50 often suffer from femoral hernia, when there is a physiological decrease in the elasticity of the connective tissue. The disease develops against the background of a discrepancy between high intra-abdominal pressure and the ability of the abdominal wall to contain it. Due to the load on the muscular-aponeurotic apparatus, a femoral canal is formed in the thigh area under the inguinal ligament. Normally, it does not exist. However, due to high pressure and in the presence of a deliberately weak place in this area, a hernial gate is formed, through which the internal organs are pushed out. Most often, these are loops of the small intestine. Femoral hernia is a pathological formation, which consists of the following parts. Hernial orifice, a place through which the protrusion of organs occurs. The hernial sac is a part of the peritoneum that acts as a container for that part of the internal organ that protrudes. The content of the hernia is actually the protruding part of the intestine. In the early stages of the disease, pathological protrusion rarely causes severe discomfort. The patient may complain of the appearance of a small tubercle in the thigh area, which increases with physical activity. When pressed, the formation freely hides back. Such hernias are called reducible. However, the absence of other clinical signs is only a matter of time. The danger of such a situation lies in the possible complications of reducible hernias, which can be inflammation of the contents of the hernial sac. Against this background, there is a danger of perforation of the intestinal wall and even the risk of developing sepsis. Infringement of a hernia. The blood supply to the compressed part of the organ is sharply disrupted, which can lead to tissue necrosis. Coprostasis. If an intestinal loop enters the hernial orifice, the process of passage of feces through the digestive tract is disrupted. Feces accumulate above the compression site. Intestinal obstruction develops. Such clinical situations require immediate hospitalization of the patient for emergency surgery. Otherwise, there is a real threat to human life. Symptoms of a femoral hernia. In the early stages of the disease, patients complain mainly of the appearance of an elastic tubercle in the thigh area. A characteristic feature is the change in the size of the protrusion depending on the position of the body. When walking and during physical activity, the bulge increases. At the same time, the patient may experience discomfort or pain that occurs due to tissue overstretching due to increased intra-abdominal pressure. When complications occur, the following manifestations may appear. Severe pain. Redness of the protrusion, swelling, increased local body temperature. Nausea, vomiting. The appearance of blood in the stool, the absence of defecation and discharge of gases. When these signs appear, the hernia is no longer reduced back and is called irreducible. This situation requires the fastest possible delivery of the patient to the surgical department for surgical intervention. Causes of a femoral hernia. The femoral canal is a pathological anatomical formation through which the hernia comes out. Normally, such a structure does not exist, but with the development of an imbalance between intra-abdominal pressure and the supporting function of the abdominal wall, gaps form between the muscles and connective tissue bundles. Through them, the internal organs are pushed out. One of the key factors that increase the risk of developing the problem are various collagen abnormalities. This protein serves as the basis for the connective tissue structures that make up the muscle aponeurosis. Due to molecular defects in its structure, weak places are formed in the anterior abdominal wall. With an increase in intra-abdominal pressure, it is they who turn into a hernial ring. Other factors that increase the risk of developing femoral hernias are sharp weight loss. With a rapid loss of body weight, the muscles do not have time to adapt to a new mode of operation. They lose elasticity. Because of this, a zone is formed in the area of the femoral canal that is less resistant to pressure increase. Injuries and surgical interventions in the corresponding part of the body. Any damage to the muscle connective tissue fibers reduces their strength. Damage to the nerves that innervate the abdominal wall. Because of this, its blood supply worsens, it loses its tone, creating conditions for the formation of a hernial ring. Pregnancy. Bearing a child affects the functional state of the abdominal muscles. All this increases the risk of developing hernias. The above factors are predisposing. They create conditions for the formation of hernial ring. Provoking factors are situations accompanied by a sharp increase in intra-abdominal pressure. It could be physical stress, hacking cough in lung diseases, pushing during childbirth, prolonged constipation and straining during bowel movements. The appearance of even a slight elastic protrusion in the thigh area is an indication for an immediate appeal to the surgeon. Otherwise, serious complications of the disease may develop. Diagnosis of a femoral hernia. The detection of femoral hernias is a relatively simple task for a skilled surgeon. The doctor, during a conversation with the patient, evaluates complaints, collects an anamnesis of the disease. Next, the doctor examines the pathological area. If an elastic neoplasm is detected, he may try to set it with his hands. With a successful attempt, it becomes possible to evaluate the hernia orifice, which is a defect in the muscular-aponeurotic layer of the patient's abdominal wall. In 85% of cases, based on such a simple diagnosis, the surgeon can establish the correct diagnosis. To confirm it and assess the general condition of the body, the following additional examinations are prescribed. General analysis of blood and urine, biochemical analysis of blood. They allow to exclude the inflammatory process and identify concomitant pathology. ECG, chest X-ray. These tests are needed to evaluate the function of the lungs and heart before the upcoming operation. Ultrasound of the pathological zone and the abdominal cavity. Using this method, the doctor evaluates the size of the hernia, reveals the concomitant pathology of the internal organs. X-ray computed tomography, RCT. The procedure is prescribed for patients with severe obesity and constant recurrence of hernias during treatment. Magnetic resonance imaging, MRI. Indicated in difficult diagnostic cases. Based on the information received, the surgeon develops an individual treatment and rehabilitation plan for a particular patient. Methods of treatment of femoral hernia. A femoral hernia is a surgical pathology that is not amenable to medical treatment. The best results are provided by modern minimally invasive surgical interventions. Conservative treatment. Conservative treatment for femoral hernias is aimed at temporarily improving the patient's well-being in preparation for surgery, during and after it. Used groups of medicines. Painkillers. Antibiotics, if necessary. Nonsteroidal anti-inflammatory drugs. If the patient suffers from a concomitant pathology of the internal organs, appropriate medication is prescribed, laxatives, enzymes, cardiological agents, and others. Surgical treatment of femoral hernia. The gold standard for the treatment of femoral hernias remains their surgical treatment. The essence of such an intervention is to remove the hernial sac and strengthen the abdominal wall. For this, both the patient's own tissues and artificial mesh prostheses can be used. With the development of irreversible damage to parts of the internal organs that are in the hernial sac, they must be removed. The operation of hernia repair can be performed in various ways. The surgeon in each case chooses a personalized tactic, taking into account the size of the protrusion, the anatomical features of the patient, and possible risks. The most effective today are minimally invasive interventions with the implantation of mesh prostheses. They achieve good results without reherniation in 95 to 99% of patients versus 85 to 90% with conventional open surgery. Rehabilitation after surgery. The recovery of patients after a planned endoscopic hernia repair takes an average of 2 weeks. Due to minimal damage to healthy tissues, patients are discharged home the very next day after surgery. Within 15 to 20 days, you should refrain from physical and sexual activity, refuse to go to saunas, baths, pools. To speed up recovery, you need to follow the recommendations of the doctor, eat well and get more rest. When using open, traditional operations, the recovery period can be extended up to 1 month. The patient is discharged from the hospital after 3 to 4 days. At this time, the surgeon daily monitors the condition of the postoperative scar, performs dressings. Due to the larger incision, the risk of postoperative complications in the form of hematoma formation and pain syndrome slightly increases. Patients are given antibiotics to prevent infection.